This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week on the program, I'm coming to you from Joshua Tree Pediatrics at KRMC. My guests are Rauchel Farris and Diane Bickle. They're both nurse practitioners here. Rauchel, welcome.
Thank you.
Diane, welcome.
Thanks. Great to be here.
Rauchel, we talked quite a while ago. We did an interview, I don't know, some years ago? I have no idea now. It's a fog. When was that? Any idea?
Yeah, 2017.
Okay.
No, 2018.
So you managed to get under the radar here for a while. I didn't bother you for a while.
Yeah, and then when you came knocking, I was happy to say yes.
And thank you. And Diane, this is our first chat. Welcome.
Yes.
How long have you been at KRMC?
Almost 2 years.
And you said as we were setting up, this is like coming home for you.
It is. I was born and raised here.
And welcome back.
Thanks.
Today on the program, we are talking about cold and flu season. We are talking about RSV and everybody's favorite topic, COVID. And we want to give listeners some tips on staying healthy and reducing time away from work and school. So let's start with the flu. So correct me if I'm wrong, ladies, but as I understand it, the flu virus is a little different each year, and it arrives during the fall, and we know a little bit about the virus because of its behavior in the southern hemisphere, because they're coming out of winter and we're going into. So what do we know so far about this year's flu virus?
So you're absolutely right. We develop our immunization based on the Southern Hemisphere, and the CDC typically in the past receives thousands of samples from these different countries. This is a crucial step for understanding the evolution of these viruses. It helps us develop the flu vaccine for the next flu season. There's a lot of information circling around right now regarding the changes that have been made in the order and how we process this information through the CDC. It is still highly recommended to have the yearly flu immunization, although prediction of exactly which virus will dominate this season has been a bit more difficult to determine.
Let's review a little bit about cold and flu symptoms.
So the biggest thing with the flu is it usually comes on very quickly. Very high fevers, body aches, chills, cough, runny nose, sometimes stomach things, but less likely. Whereas cold symptoms can be similar, but usually not as intensive and usually don't come on quite as quickly. Most children will get mini colds, especially if they are in school or daycare situation. And they're usually pretty mild. Now, sometimes small children will also get a little bit of a fever, but usually it's more the runny nose, congestion, cough, not quite as extreme as flu symptoms that, they might last about the same amount of time, although colds can usually last a little bit longer, 1 or 2 weeks. Both of them are viruses, not something we would be giving antibiotics for. But, it is important to kind of look at what's going on with you before you decide whether you need to stay home from school or come in. Certainly a fever, you need to stay home.
When those symptoms begin, what is the best thing to do at onset?
So the best thing is to stay as hydrated, drink as much fluids, especially water, rest as much as possible, and treat what we call supportive care, which might be rest, fluids, a cool mist humidifier. For babies, that certainly also means using some saline and suction out their nose. But it's, mostly keeping hydrated, and time is also most important.
Yeah. And Rauchel, this might just seem like simple advice, but can we cover a few of the best practices for staying healthy in general during cold and flu season?
Yeah, so hand hygiene, above all, number one. Good hand hygiene, covering coughs and sneezes, and avoiding those who are ill. Staying home when you are ill.
Well, Rauchel, it can be difficult for people to take time away, and obviously that's the best course so that you can rest and also so that you don't get other people sick. But when do we know that it's safe to go back to work or to school?
That's a great question. How you know is textbook says 24 hours without a fever, without an analgesic. That means 24 hours fever-free without taking Tylenol or ibuprofen. A fever is defined as a temperature of 100.4 degrees or higher. But the thing is with influenza, that is different than the common cold, is you will see those higher temperatures. And that's one of your indicators that this might be a little more serious, and that's a good time to seek medical care.
I'm glad you brought that up. Many of these things we can manage at home. We can just rest and get by.
Yeah.
And I wanted to ask, what are some of the indicators that, maybe I should go and have a professional see me? So the very high fever.
So certainly if you think, number one, you've been exposed to the flu, you have the high fever and chills, we do have an antiviral medication, Tamiflu, that we do have to start within the first 24 to 48 hours. So if you do think you have the flu, that would be an important time to come in, especially really young children or anyone with a chronic health issue, say asthma, or living in the home with elderly people or someone who is compromised. You're probably going to want to get treated because children do tend to be very contagious with the flu and therefore very much exposing other family members. With a cold, you can probably manage it at home. And if you don't have that high fever, that's a pretty good indicator that it's not the flu. But we can always do a flu test, and that's how we know for sure.
Yeah, and when we talk about how do we know when we need to seek medical care, so signs of dehydration, the kiddo is not drinking well, not keeping fluid down, or you have a decrease in urine output. A baby should have a wet diaper at least every 8 hours. If they're not doing that, then you have some concern for dehydration. The other symptom that elevates your concern is signs of respiratory distress. In an infant, this looks like nasal flaring, retractions, stridor, fast breathing. These are all red flags of, hey, my kiddo is struggling and we need to be seen.
Yeah, and I can just say, as you know, my wife is a pediatrician, and I remember all those years when she was on call and she would take phone calls late at night, and I was only hearing half of the conversation, right? But it was about respiratory distress. Oh dear, okay, well, how long has this been going on? 4 hours, okay. And just to emphasize the point, I'm not a doctor, but I play one on the radio. Respiratory difficulty is not something that waits until tomorrow morning.
That is correct. It needs to be addressed now, sooner than later, because children turn fast.
We're talking about the signs and symptoms of cold and flu. How long, let's begin with the common cold. How long does that usually hang around?
Sometimes as long as up to 2 weeks, and sometimes just 5 or 6 days. But, usually it's not getting worse. It's just staying about the same.
And the flu, how long do we expect that to last?
We hope only 5 to 7 days. Sometimes if you're taking the antiviral, it can cut that down a little bit. Some people get rid of the fever but still are very fatigued for the second week. But definitely that first week, you can expect some symptoms.
And with influenza in particular, when we talk about the duration, if you have the complication of pneumonia, which is what we worry about the most with an influenza infection, then that can last weeks, and a lingering cough can be even a month out, requiring antibiotics and hospitalization.
Speaking of respiratory issues, let's talk a little bit about RSV, or respiratory syncytial virus. Diane, it looks like you've been nominated to take that one.
So RSV may start out as a common cold, but the difference for babies and small children in particular is it becomes what we call bronchiolitis. So you think of bronchitis in an adult. Bronchiolitis affects all their small airways, causes a lot of mucus production. So it's going to be a significantly worse viral infection, not just a cold, although in older kids and adults might be a cold, and then they transfer it to a young baby. But we've been making some big changes in the last 2 years with the RSV vaccine coming out about 3 years ago. We've seen a huge, significant change in the amount of infection and definitely the hospitalizations. In fact, I read some research on it today about how it's cut down ICU, so the PICU admissions for babies by 90%.
Wow.
So it's made a big impact in our babies.
When we talk about RSV and babies in particular, what is the age range most at risk?
Probably your 6 month and under, but certainly the first 2 years of life, they're still impacted by RSV. But we have newborns, right now coming into RSV season, which typically runs from about October to April. And that's the same time frame they will offer the vaccine as well. And I know we definitely saw a big change last year, and hopefully we'll see the same this year with reduction. And again, like any vaccine, it doesn't mean you can't get any of the symptoms or can't get RSV, but it should be much less significant and not require hospitalization.
I'm glad you talked about vaccines. We have to talk a little bit about vaccines, and I always offer this caveat. We talk about them a fair amount on the program, and I always offer this caveat that this is not a political show, and it's kind of weird to me that I have to offer that. But certainly, the topic of vaccines can be divisive. And so you have the COVID vaccine, you have the flu vaccine, you have the whole childhood schedule of vaccines. And in recent years, I think it's safe to say we've seen a growth in vaccine hesitancy. Is that safe to say?
That's very safe to say.
Yes.
Okay.
Yeah. Social media. A lot of people have access to more information than they've ever had before. And a lot of that information can seem kind of scary. So I take it on myself. My job is to make sure that you are fully informed as the parent, and then help support whatever decision you make for your child.
Right. And Diane just mentioned the RSV vaccine and the huge reduction in pediatric ICU cases. So have you seen this hesitancy in regard to the RSV vaccine as well?
I have not.
No.
I would honestly say I've seen less hesitancy to this one than to some of the other regular childhood vaccines.
Interesting.
Which has been pleasantly surprising.
So at least you have that, right? Mm-hmm. So it doesn't take a whole lot of convincing to have parents get the RSV vaccine. You have some persuasive numbers if you would need them, right? But
definitely.
I find that statistics really don't help.
Okay.
Connecting with your patient,
Yeah.
really explaining, listening, and helping guide them in their decision making is what makes a difference.
Yeah. It may be conversation for another time about the childhood vaccine schedule, because that's another different issue, right?
So that's ever changing. I used to direct my patients to the CDC, which is still a good place to look at information and see the evidence-based studies. Immunizations have been researched just about or more than anything else in medicine. Mm-hmm. They are very safe. Deriving information from reliable sources is important, along with evaluating this information with some kind of health literacy. Yeah. The place that I receive my information from right now is the American Association of Pediatrics. I find that they are a good, solid place to make my recommendations from.
You mentioned it, the CDC, or the Centers for Disease Control, and the AAP, the American Association of Pediatrics. They have, in the case of COVID, for example, in the COVID vaccine, they have different guidelines. So in which cases are you recommending it here in the clinic?
They do have different guidelines. Again, I obtain my information from the American Association of Pediatrics. Right now, their recommendation is a single dose of COVID vaccine for children who are moderately to severely immunocompromised. The AAP schedule outlines which chronic conditions place a child at higher risk. Mm-hmm. Yes, the AAP guidelines differ from federal guidelines and CDC state policy. In 2025, the AAP released its own evidence-based pediatric immunization schedule and COVID-19 schedule, and these recommendations don't mirror what the CDC recommendations are. Right. Again, it goes back to shared decision-making remains the cornerstone for families and providers, and the AAP supports this.
Well, you touched on the importance of having someone trusted in the medical profession you can speak with. As a parent who maybe doesn't know the topic well, to say, well, I know we can trust our nurse practitioner, our pediatrician.
Absolutely. I think having those discussions, offering solutions with them, trying to find out where they're coming from, if they're walking in saying, oh, we don't want any vaccines of any type, or whatever it might be. Yeah. Working through those conversations and having a good relationship really does help.
If you're just joining us, I'm TG LaFredo. This is Focus on Your Health. And this week on the program, I'm coming to you from Joshua Tree Pediatrics at KRMC. My guests are Rauchel Farris and Diane Bickle, both nurse practitioners, and we're talking about cold and flu season. We are early in the COVID season. Have you seen many cases so far?
I have not really.
I have seen 2 cases.
2, yeah. Just last night, ladies, I did check the CDC website, and according to the information there, everyone 6 months or older should get a flu vaccine every season with rare exceptions. And the CDC states that the flu vaccine can reduce flu illnesses and missed work and school due to flu. And so it also can reduce the symptoms in those who do have the flu. So my question is, do many of your patients get the flu vaccine?
I would say quite a few of ours do.
Yeah.
Especially if they attend school and daycare, because those are the working parents and they want to reduce their risk, if at all possible.
Just about every year when the flu vaccine question comes up, someone will say to me, I don't get it anymore because I get so sick. I got the flu vaccine and then I was down with the flu for a week. Can you get the flu from the flu vaccine?
You definitely cannot. That's one of my favorite questions because people do say that a lot. And it's like any other dead virus. It goes in and works on your immune system. But if you were already fighting off something, say you were getting sick from someone, you might still get sick. And in your mind, you think it was because you got a shot. But I always tell people when you're getting your flu shot or any other vaccination, eat healthy, get lots of sleep, do all the things that keep you healthy. And, you shouldn't be bothered by your vaccine other than maybe a sore arm or a little tired, but that's a normal response to a vaccine.
Rauchel, I was reviewing your bio on the hospital's website, and it says that you're involved in KRMC's Antimicrobial Stewardship program. It seems like this is related to the conversation in that most viruses, as we said, require time and supportive care, and antibiotics are not the right treatment. In fact, as a patient, you want to reserve antibiotics as an option for when you really need them, so they'll work for you. But I can tell you also that over the years, different providers have told me they will have patients come in and they're lobbying for an antibiotic, and the provider may say, no, it's a virus. Antibiotics are not the right response here. But if there's any doubt in the patient's mind or the parent's mind, it's, no, this is what we need. We don't want to waste any more time. This is related to antimicrobial stewardship, right?
Yeah.
Do you have this? Does this come up in your practice?
Yeah, of course this comes up frequently. I think it's because parents want their children to feel better, and they want them to feel better fast, and in their mind, antibiotics are the answer. My approach is first to listen to the parents, acknowledge the symptoms, the discomfort, their concerns. People want to be heard. I'm big on sharing the knowledge that I have and educating my patients and families in simple, clear terms that they can understand about why I'm making the suggestions that I'm making and why antibiotics are not appropriate in certain cases. With that being said, I also offer an alternative plan to antibiotics for symptom relief with a clear plan about follow-up. This looks like what they can expect for their child to feel better in 7 to 10 days. What if their child develops new symptoms? When do they need to call me, or when should they come back? Parents are very smart and intuitive on how their kiddos are feeling. If you give them the tools, they can help make good choices.
Knowing that cases are different and kids are different, I understand that part, but what might some of the aspects of that alternative plan look like? Is it mostly about rest, nutrition, hydration, or there could be other factors?
Symptom relief. Yeah, that's what they want. They want their kids to feel better. So instructing them on how and when to give Tylenol. If you have a fever, you feel awful. So simply treating a fever can make night and day difference on how your child is behaving, eating, drinking, and feeling overall. The other thing I would like to touch on is multi-symptom medications. I really don't recommend those.
Why is that?
Because a lot of them will have Tylenol in it. And you want to be very careful not to duplicate medications. So giving Tylenol for a fever and then giving a multi-symptom medication, you can inadvertently be giving them too much Tylenol. The other thing is I like to treat the symptom that the kiddo has right now. So if they have a runny nose and some congestion, I like a simple antihistamine, and then you can build upon that. Some other things that can help, definitely cool mist humidifiers, rest, hydration, And then, again, giving them the tools for a clear follow-up plan. Usually, I say in 3 days, your kiddo should be feeling a little bit better. When you have a cold or illness, the first days 1 through 3 are you're climbing the mountain of illness. You're starting to feel sick. At days 4 through 6, you're at the top of the mountain. You're feeling the worst you're going to feel. You're miserable, you're down. That's when you really need the medicines and the supportive care. Days 7 through 10, you're coming off the mountain. You still have symptoms, but you're feeling better.
Diane, in your years of patient care, you've probably had this experience as well, where parents are kind of lobbying for the wrong course of action.
Absolutely. Antibiotics seem to be what people perceive would fix things. And obviously they only treat bacterial infections such as strep throat. That's a different story. But if we're talking about a cold or flu, again, it's the supportive care and things as simple as we're going to do either a natural honey-based cough syrup or just a spoonful of honey, the old remedies, the Vicks Vapor Rub, things that might help them more than, as Rauchel said, we don't like to use a large, multi-type medication that's trying to treat different things. And unfortunately, that seems to be what people want. They want some sort of quick fix, and we're trying to help them, but yet also do what's best for the child.
Yeah. I know from your bio that you have a background in educating nurses, right?
Yes.
And I wonder, this is kind of a side note, but I wonder, how do you, like when you're training them, how do you address this stuff with them in terms of conveying the right information? How did you train them to do that?
So I do have a lot of education experience with nurse practitioner students, and I think trying to help them learn what does an ear infection look like that actually would need antibiotics versus these are just cold symptoms, or for example, when children are crying, their ears are red. If they have a fever, their ears are red, because parents hear that and they automatically think they need an antibiotic for a red ear. And so just trying to get them to make a good assessment that then helps, and also feel comfortable enough as a new provider that they have to make a shared decision, not just kind of cave in and give antibiotics.
Yeah, yep. Well, we talked about some of the ways that people can manage sickness at home, but then as we also discussed, sometimes you need to see someone. What are the chances of getting in to see a provider here at Joshua Tree Pediatrics during this time of year? Is it a crazy busy time?
It is a very busy time. However, we have many same-day sick appointments available each and every day. We currently have 4 providers here at Joshua Tree Pediatrics, and each of our schedules has slots available for same-day sick appointments.
You've been hearing from Rauchel Farris and Diane Bickle. They are both nurse practitioners at Joshua Tree Pediatrics at KRMC. You can reach their office at 928-681-8706. That's 928-681-8706. Special thanks this week to Katie Zumwalt. She's the clinic manager at Joshua Tree Pediatrics, and she coordinated this interview. Ladies, thank you so much for your time today.
Thank you for coming.
Yes, thank you.
And that is the program. That's another edition of Focus on Your Health. I'm TG LaFredo, and thank you for listening. We'll catch you next time. You can listen to it again and again if you'd like.
Absolutely.
All right, a link.